Some of the tips for taking warfarin that I think are probably important, particularly for older patients, they're often doing a little bit of travelling. Now, if they're travelling, their diet changes. Even if they go up the coast to stay with their daughter or something like that, they're probably not eating the same as when they're at home. And so their INR is likely to change. So whenever they're travelling, they need to have arrangements in place to probably get more frequent INR testing, because they're unlikely to be as stable during the time they're travelling. So that's one thing. Another time when their INR may not be stable is when they've got a virus or something, particularly one that's got nausea, vomiting or diarrhoea. And once again, it can be appropriate during those times to have more frequent INR testing. Now, most patients will have a pathology referral which will allow them to turn up when they need to turn up to get their blood collected. So when they get an infection or something, it's probably appropriate at that time to do the tests a little more frequently, maybe every couple of days for a while they're sick, to make sure the INR isn't going too low, which is probably the most common risk, or perhaps even too high. Now, having done that, if they're sick enough to go to the doctor, they should go, but also they should be in touch with the doctor to let them know there are additional INR tests to be done, and to make sure the doctor is looking at those INR tests to see if the dose needs to be changed. Now, during illnesses, people sometimes take all sorts of medications. They might be taking echinacea, they might be taking other alternate treatments, or they might even be on antibiotics. Those things can interfere with your INR testing. Same again, if there's something that can interfere, like travel, change of diet, illness, or new medication, the solution to that is having more frequent INR testing to make sure you're staying in range.